You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. Greetings, everyone, and thank you for joining me on this episode. Welcome to Public Health Entrepreneurs. This is the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in healthcare and public health, I understand the unique challenges and opportunities that come with bridging multiple disciplines. If you are a high-functioning leader with expertise across different fields, whether you are a medical doctor, a dentist, a pharmacist who also has a public health degree, or a public health doctor who also has expertise in another field, or any other interdisciplinary professional, you know what it's like to see opportunities that others miss, and you also understand the gaps in current systems, and you have a lot of really good ideas about how to make things better. Sometimes having that unique perspective can feel a little isolating, especially when it seems as though others around you aren't as excited about or as open to your ideas. It's okay. I understand. And it's why we focus this podcast, especially this current series of episodes, to provide you with the type of support that you need. More practitioners are discovering opportunities to scale their impact beyond traditional roles. Yet, making the transition from practitioner to entrepreneur involves more than just launching a business. It requires a fundamental transformation in mindset, identity, and practical approach. In today's episode, we are going to take the discussion from our previous episode a little bit further to discuss making the mental shift from practitioner to entrepreneur. Now, there are three things that I'd like to share with you on this episode. There's so many things I could talk about on this under this umbrella, but we're going to try to slim it down, and I've narrowed it down to the three things that I really want to share. Key differences. Well, let's say, first of all, I want you to understand the entrepreneurial mindset. Okay, so that's like the first thing I want you to focus on, understanding the entrepreneurial mindset. Now, there are key differences between practitioner and entrepreneur in terms of the way of thinking. Common mental blocks and how to overcome them are a part of this. There's risk tolerance and decision-making, fatigue, vision and goal setting. Making the leap from practitioner to entrepreneur in public health requires a fundamental shift in how we view our role and impact in the healthcare ecosystem. As practitioners, we're trained to work within established systems, following evidence-based protocols and focusing on individual or community outcomes within defined perimeters. However, the entrepreneurial journey demands that we expand our vision beyond these boundaries, seeing gaps in the systems not as frustrations to work around, but as opportunities to create innovative solutions that could benefit thousands or even millions of people. This mental pivot from problem solver to problem revolutionizer is often the most challenging first step. If you're in that first step, if you're feeling any of that, feeling some kind of way about it, it is normal. It's okay, but you're going to definitely have to move past it. But just understanding that shift is one of the first and most important things that needs to happen. The second thing is identity transformation. So releasing limiting beliefs, building entrepreneurial confidence, managing imposter syndrome. Notice I say managing, not eliminating, because we really don't eliminate it, and creating your new professional identity. The transformation of our professional identity from practitioner to entrepreneur can feel like learning to speak a new language while still practicing our native tongue. I'm chuckling because, it still resonates with me several years in. We might grapple with imposter syndrome as we step into business meetings armed with our public health expertise, but feeling uncertain about our business acumen. Yet it's crucial to recognize our deep understanding of health systems population needs, and evidence-based approaches gives us a unique advantage in the healthcare marketplace. Our clinical and public health expertise isn't baggage to shed, but rather a foundation to build upon as we develop entrepreneurial capabilities and confidence. Now, the last thing that I want to share with you, these are powerful. I hope you're feeling this. But the last thing I want to share with you are practical transition strategies involving time management during transition, financial planning for the shift, building your support system, important, and creating your transition timeline. The practical reality of transitioning requires us to become masters of parallel processing, maintaining our current practice while building our entrepreneurial venture. This period often feels like having one foot in each world, requiring careful time management and strategic planning. It's essential to view this phase not as a binary switch, but as a gradual evolution where we can thoughtfully build our support network, test our ideas, and create a financial runway that allows for sustainable growth. Many successful healthcare entrepreneurs find that maintaining some connection to practice, even as they scale their ventures, helps them stay grounded in the real world problems they're trying to solve while providing stability during the early stages of their entrepreneurial journey. This is energizing to me, but I hope that you may find yourself in one of those 3 points that I brought up for you. But I just want you to know, I want to normalize the feeling and just say, okay, this is where we are, and help you identify where you are. But the journey from practitioner to entrepreneur in public health is both challenging and rewarding, offering unprecedented opportunities to scale your impact and transform public health. While the path may seem daunting, remember that every successful public health entrepreneur once stood where you are now, wrestling with similar doubts and challenges. The key to the approach is transition not as abrupt change, but as a thoughtful evolution, building upon your valuable expertise while developing new entrepreneurial capabilities. As you move forward, stay connected to your core mission of improving health outcomes. Let it guide your business decisions, and remember that your practical experience is a unique advantage in the entrepreneurial ecosystem. The world needs more public health entrepreneurs who are willing to take the leap into entrepreneurship. So your experience, insight, and dedication could be the catalyst for the next major innovation in public health. As we wrap up this episode, I would like to remind you that I have 2 ways to support you on your entrepreneurial journey. If you're looking for personalized guidance, let's work together one-on-one, especially now while I have the opportunity to do so. I don't always have the opportunity to offer that, but as someone who understands the unique challenges of being an interdisciplinary leader, I can help you turn your innovative ideas into reality. Now, if you're ready to join a community of high-functioning leaders like yourself, then consider applying for our premium mastermind group program. You'll connect with other professionals who are bridging the, multiple disciplines like you and creating meaningful change in public health. Either way, visit publichealthentrepreneurs.com to learn more. There is a full page on that website for the mastermind, and you can follow all the details there. If you're looking for the opportunity to work one-on-one, you'll need to click on the contact from the main menu and send us a message and let us know that you heard about this opportunity on the podcast and you want to know if it's still available. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. Visit publichealthentrepreneurs.com to learn more.